Welcome. This episode focuses on obesity, related disorders, and weight management. I'm Yenna, and as always, I'm joined by Ethan Jones. Today, we're diving into the digital health revolution, how technology is changing the way we approach obesity care. Ethan, I have to say, the pace of change is just wild. I mean, AI is everywhere now, right?
Absolutely, Yenna. It's almost hard to keep up. Just a few years ago, AI in healthcare felt like a bit of a buzzword, but now it's genuinely part of the medical team. We're seeing things like ambient listening, basically AI that sits in the background during consults, picking up on conversations and helping with documentation. It's become, almost expected in a lot of clinics.
And it's not just about making things easier for clinicians, is it? These AI scribes, for example, they're not just transcribing. They're actually understanding context, summarizing charts, and even automating some of those repetitive tasks that used to eat up so much of our time. I remember when I first started teaching, we were still handwriting notes. Now it's like, if you don't have some kind of AI support, you're behind.
Yeah, and the numbers are staggering. I read that there are over 1,000 FDA-approved AI medical technologies now. Most aren't generative AI yet, but that's coming. And the data load, 50 years ago, an ICU patient might have 7 data points. Now, it's more like 300. That's a massive cognitive burden for clinicians. I had a day in clinic recently. I'll admit I was a bit frazzled. And the AI-driven documentation just took so much off my plate. I could actually focus on the patient, not the paperwork. It was a bit of a revelation, honestly.
That's such a good point. And we talked in our last episode about how complex obesity is. It's not just BMI. It's visceral fat, hormones, all these moving parts. AI can help us make sense of that complexity, pulling together data from wearables, labs, even patient-reported outcomes. But I do worry a bit about equity. If we're not careful, these tools could widen the gap for people who don't have access.
Yeah, that's a real concern. The AMA and others are pushing for ethical, equitable deployment, making sure these tools actually help everyone, not just those in big city hospitals. And I mean, the tech is only as good as the way we implement it. If we just throw AI at old problems without thinking about process and people, we're not really moving forward.
Exactly. It's about thoughtful integration, not just hype. And I love that we're finally seeing clinicians, not just tech companies, leading the conversation about what actually works in practice. Where was I going with this? Oh, right. So, AI is now a real member of the care team. But it's got to be implemented with care, or we risk repeating the mistakes of the past, like with electronic health records. Let's not do that again.
Speaking of integration, let's talk about wearables and remote monitoring. This is another area that's just exploded, especially for chronic disease and obesity management. I mean, it used to be just step counters, right? Now we've got continuous glucose monitors, CGMs, being used not just for diabetes, but for anyone wanting to understand how their body responds to food, stress, even sleep.
Yes, and I actually had a student last semester who did a project on this. They used wearable data to flag early signs of metabolic syndrome in a group of at-risk patients. It was fascinating. Some people had no idea their blood sugar was spiking after certain meals, or that their sleep patterns were affecting their metabolism. The wearables gave them real-time feedback, and that made the lifestyle changes so much more tangible. It's like, suddenly, the science is personal.
That's brilliant. And it's not just about the data, it's about engagement. When patients can see their own numbers, they're more likely to take action. But I'll admit, sometimes the sheer volume of data can be overwhelming for both patients and clinicians. There's a real need for better workflows, otherwise we risk drowning in information instead of using it to drive better care.
Absolutely. And interoperability is still a headache. If the data from your wearable can't talk to your doctor's system, it's not much use. But I do think we're moving in the right direction. There's more focus now on integrating these tools thoughtfully, not just for the sake of having the latest gadget, but to actually improve outcomes. And the hospital at home model is getting a lot of attention, using remote monitoring to keep people out of hospital when it's safe to do so. That's a big shift.
Yeah. And it ties back to what we discussed last episode, meeting people where they are, not just in the clinic. Wearables and remote monitoring can make care more continuous, more proactive, but we've got to make sure everyone can access these tools, not just those who can afford the latest device. Otherwise, we're just creating new disparities.
Right. And that's where policy and clinical guidelines come in. We need clear standards for how to use this data, how to protect privacy, and how to make sure it's actually helping, not just adding noise. But I have to say, I'm excited. The potential for early intervention, for really personalized care, it's huge. And students are so engaged with this stuff, which gives me hope for the future.
Let's shift gears a bit and talk about telehealth and digital therapeutics. Telemedicine really took off during the pandemic, and while usage has dropped a bit since, it's still a vital part of the landscape, especially for rural Australians. But there's a bit of uncertainty now with some of the Medicare telehealth flexibility set to expire unless there's policy action. That could really impact access for people outside the cities.
Yeah, and it's not just about video calls anymore. We're seeing a whole ecosystem of digital therapeutics, software-based interventions that can help with weight management, medication adherence, even health education. Some of these apps are evidence-based, and they're being used alongside medications like GLP-1 agonists, Ozempic, for example, to support the lifestyle changes that are so crucial for long-term success. But as always, there are challenges: data privacy, user engagement, and making sure these tools are accessible to everyone, not just the tech-savvy.
Exactly. And there's a real opportunity here to integrate these digital tools with traditional care. Imagine a patient on a GLP-1 agonist who's also using an app to track their meals, get reminders, and connect with their care team. That's a powerful combination, but we've got to be careful. If we don't address the digital divide, we risk leaving some people behind. And of course, there's the question of how we evaluate these tools. What's actually effective and what's just hype?
That's the million-dollar question, isn't it? I think the key is thoughtful, evidence-based implementation. We need to keep the patient at the center, make sure clinicians are involved in designing and evaluating these tools, and always be thinking about equity. It's an exciting time, but we can't lose sight of the basics: good communication, trust, and a focus on outcomes that matter to patients.
Well said, Yenna. I think that's a good note to end on. The digital health revolution is here, but it's up to us, clinicians, patients, policymakers, to make sure it delivers on its promise. Thanks for joining us today. And as always, we'll be back soon to dig even deeper into the future of obesity care.
Thanks, Ethan. And thank you to everyone listening. Keep those questions coming, and we'll catch you next time.
Take care, Yenna. See you next episode.